Meningitis. It's a word that can strike fear into anyone who knows its potential consequences. But what exactly is it? In simple terms, meningitis is an inflammation of the meninges, the protective membranes that surround your brain and spinal cord. Now, inflammation anywhere in the body is never a good sign, but when it affects such vital organs, the stakes are even higher. Meningitis can be caused by a number of culprits, including bacteria, viruses, fungi, and even parasites. Bacterial meningitis, however, is the one we need to be most wary of. It's a medical emergency that demands immediate attention, as it can quickly escalate, leading to serious complications like brain damage, hearing loss, and even death. But don't panic just yet. While meningitis is a serious condition, understanding its causes, symptoms, and prevention methods is the first step in protecting ourselves and our loved ones. In this essay, we'll delve into the world of meningitis, equipping you with the knowledge to recognize and address this potentially life-threatening illness. Meningitis, as we've established, is an inflammation of the meninges. But just like there are different ways to light a fire, there are different ways this inflammation can occur. These different ways are essentially the different types of meningitis, each with its own set of causes and characteristics. The most common types are viral, bacterial, fungal, and parasitic meningitis. Viral meningitis, while unpleasant, is often milder than its counterparts and usually clears up on its own. Fungal and parasitic meningitis, on the other hand, are less common and typically affect individuals with weakened immune systems. Bacterial meningitis, however, deserves our special attention. It's the most dangerous type, capable of causing severe complications and even death if not caught and treated early. Unlike viral meningitis, it doesn't mess around. This is why we'll be focusing primarily on bacterial meningitis throughout this essay, understanding its nuances to better protect ourselves. Let's shine a spotlight on the most worrisome form of meningitis, bacterial meningitis. This type is triggered by several different types of bacteria, each with a knack for wreaking havoc on the meninges. One of the usual suspects is a bacterium often associated with pneumonia. Another troublemaker is, which can also cause a severe blood infection known as meningococcal septicemia. This particular bacterium is notorious for causing outbreaks, especially in crowded settings like university dorms and military barracks. Why is bacterial meningitis considered a medical emergency? Well, when these bacteria invade the meninges, they trigger a cascade of inflammatory responses. This inflammation can cause brain swelling, leading to seizures, brain damage, and even death if left untreated. The speed at which bacterial meningitis can progress is alarming, making early recognition and treatment paramount. Now that we understand the seriousness of bacterial meningitis, let's address how this silent threat spreads. Knowing the transmission routes is crucial for implementing preventive measures and protecting ourselves and our communities. Bacterial meningitis isn't as contagious as, say, the common cold. It's not spread through casual contact like touching or breathing the same air as an infected person. Instead, it primarily spreads through the exchange of respiratory and throat secretions. Think sneezes, coughs, and those times you share a drink with a mate. Close contact, like kissing or living in close quarters, facilitates the transmission of these bacteria. It's important to note that people can carry these bacteria in their nose or throat without showing any symptoms, unknowingly spreading the infection to others. This is why practicing good hygiene, like covering your mouth when you cough or sneeze and washing your hands regularly, is crucial in reducing the risk of transmission. Section 5. Recognizing the signs, symptoms of meningitis. Meningitis can be a bit of a chameleon, especially in its early stages, mimicking other common illnesses. However, understanding its telltale signs is crucial for early detection and timely treatment. Remember, when it comes to bacterial meningitis, every minute counts. The symptoms can vary depending on the individual and the type of meningitis. However, some common red flags include a sudden high fever, a stiff neck, a severe headache that's different from your usual headaches, sensitivity to light, nausea and vomiting, and a rash that doesn't fade when you press a glass against it. In infants, the symptoms might be subtler, and can include a high-pitched cry, bulging fontanelle, the soft spot on a baby's head, irritability, and difficulty waking up. Remember, these are just potential warning signs. If you or someone you know experiences any of these symptoms, especially in combination, don't hesitate to seek medical attention immediately. Section 6 Diagnosis: Confirming meningitis. Suspecting meningitis is one thing, but confirming it requires a trip to the doctor. A doctor will begin by taking a detailed medical history and performing a physical exam, focusing on neurological signs and checking for telltale symptoms like neck stiffness. To confirm the diagnosis, a lumbar puncture, also known as a spinal tap, is typically required. This procedure involves collecting a sample of cerebrospinal fluid, or CSF, the fluid that bathes the brain and spinal cord, from the lower back. The CSF sample is then analyzed in a laboratory to identify the presence of bacteria, viruses, or other pathogens. In addition to the lumbar puncture, blood tests might also be conducted to check for signs of infection and to identify the specific type of bacteria causing the meningitis. Early and accurate diagnosis is paramount in ensuring the most effective treatment plan and improving the chances of a positive outcome. Section 7. Treatment: Combating the infection. Once a diagnosis of bacterial meningitis is confirmed, treatment usually begins immediately, even before the lab results are back. Remember, time is of the essence with this infection. The cornerstone of treatment for bacterial meningitis is intravenous antibiotics. These powerful medications are administered directly into the bloodstream to quickly reach and combat the bacteria invading the meninges. The type of antibiotic used will depend on the specific bacteria causing the infection, which is why identifying the culprit through lab tests is crucial. In some cases, corticosteroids might be used to reduce brain swelling and inflammation. These medications work by suppressing the immune system's inflammatory response. Additionally, supportive care, such as fluids, medications to control fever and seizures, and oxygen therapy, might be provided to manage symptoms and complications. Section 8. Prevention is key: vaccinations and other measures. Preventing bacterial meningitis is always better than treating it. And thankfully, we have some powerful tools at our disposal, with vaccination being the most effective weapon in our arsenal. Vaccines work by introducing a weakened or inactive form of the bacteria into the body, triggering the immune system to produce antibodies. These antibodies act like little soldiers, ready to fight off the real infection if it ever encounters it. Several vaccines protect against the most common bacteria that cause meningitis. These include the meningococcal conjugate vaccine, the pneumococcal conjugate vaccine, and the Hib vaccine. These vaccines are generally safe and effective, and they are recommended for infants, children, adolescents, and adults, depending on their risk factors. In addition to vaccination, other preventive measures include practicing good hygiene, such as washing your hands frequently, covering your mouth and nose when coughing or sneezing, and avoiding close contact with sick individuals. Section 9. Life after meningitis: Long-term effects and support. Even with prompt treatment, bacterial meningitis can leave its mark, sometimes causing long-term complications that affect various aspects of a person's life. These complications can range from mild to severe, depending on the severity of the infection and how quickly treatment was initiated. Some common long-term effects of meningitis include hearing loss, vision problems, seizures, memory and learning difficulties, and problems with coordination and balance. In some cases, individuals might experience psychological challenges, such as anxiety, depression, and post-traumatic stress disorder, or PTSD, as a result of their experience. The road to recovery after meningitis can be challenging, but there is hope and support available. Support groups, counseling, and rehabilitation services can help individuals cope with the physical, emotional, and cognitive challenges they might face.